Back in 2011, I came into healthcare and we developed our own patient portal down to St. Joe's. And one of the first ones I downloaded was the Intermountain portal. Take a look at it. And back then, it was essentially a container app, right? So you'd log in, so it gave you that single login, but then it had like a whole bunch of other apps sort of in the container, and it gave us that single login experience, but it still felt a little disjointed. It sounds like you're developing it more around the experience. How do you gather the voice of the patient to really understand what they're looking for in that environment?
Yeah, really good question. And there's a lot of angles to answering that. First of all, user testing, right? So we test directly with various consumers our new design ideas, and these are typically prototypes before we invest the time to actually build out a capability or a solution. But also with existing features when we need to kind of dig in further to see if we should enhance the experience, et cetera. And historically, this has all been done in person where we would actually bring consumers in-house and work and really test through concepts, et cetera. But with COVID, we primarily have been using a new service called usertesting.com to really kind of facilitate these tests remotely. And working with that company, it's really given us the ability to work with testers as well as bringing our own consumers into tests. So that's just one example. And I'd suggest that that's kind of the most in-depth way that we do that, Bill, because you can really get that kind of one-on-one feedback experience on what's working, what's not working, how are they thinking about things, is this button out of place, is it hard to find? And so it really kind of lets you get into the mind of the individual consumer, which is really helpful. But beyond kind of just direct user testing, we have monthly surveys that we do, as well as in-app surveys that we do. And we're really careful on those in-app surveys, that we're not popping things up in your face, et cetera, but try to solicit feedback for consumers that are willing to provide that. And both those monthly surveys as well as the in-app surveys directly related to net promoter score. So we watch that pretty closely. App Store feedback, well, that's another big one. I checked a couple of weeks ago and I think we have like 4,400 reviews on our app. And I'll tell you what, we read every single one of those. And in fact, we directly interact with any of those users that happen to provide a lower score, because we really want to understand what's not working for them, because it's sort of like a mouse in the wall. If you find one, there's 10. And so we take that same type of mindset that if a particular consumer end user is struggling with a particular feature, there's probably a lot of others that are as well. So that direct follow-up and feedback is really good. Then of course we have persona research that we do to try to typify certain cohorts and build and think about full-blown patient journey maps through those processes, all the way from researching a condition to paying your bill and follow-up care and things like that afterward, and everything in between. So it's a pretty strenuous and exhaustive way to really try to understand the consumer voice of the patient.